Now you have decided your thesis topic, but don't know how to actually write it, what to write in aims, objectives, what inclusion criteria, exclusion criteria, what sample size you should take. So in this video, I'll make you understand the important terminologies used in a thesis and a thesis language in a very simple way. I'll not overload you by definition, but will just make you understand how you should actually think. So these are the 10 important terminologies that we'll understand in this video. So whatever you want to study becomes your research topic. Let's say I'm examining a fundus of patient with mild, moderate and high myopia, and I am seeing a lattice degeneration. And I think, is there more chances of lattice degeneration in a patient with high myopia than with patient with moderate myopia? So this one question becomes my research topic. Right now, there is one doubt in my mind. I have not formatted it. So when I format it in a formal and scientific language, it becomes my aim. So what is aim? To compare the prevalence of lattice degeneration in a patient with high myopia and a moderate myopia. Now this becomes my aim. Aim is my destination where I want to reach to compare between the both of them. And to reach there, what steps I will actually take becomes my objectives. So what I will do to compare this? So I will examine the fundus of a patient with high myopia. What is the prevalence of lattice degeneration in them? I will examine the fundus of patient with moderate myopia and will note down of what is the prevalence of lattice degeneration. I will compare both of it. So what becomes my objective is study the prevalence of lattice degeneration in a patient with high myopia, to study the prevalence of lattice degeneration in a patient with moderate myopia, and to compare the prevalence between both of them. So this becomes my objective. Okay. Now, what is the hypothesis? Hypothesis means before starting the research, I have some expectation or final result made up in my mind. Let's say I'm thinking that high myopia patient has a more chances of lattice degeneration than patient with a moderate myopia. So this becomes my hypothesis that there is a difference between high myopia and a moderate myopia. So null hypothesis means null hypothesis tells that there is a no difference of lattice degeneration between both of them. So that becomes the hypothesis. Whatever you want to study but has not yet proven, this is your hypothesis. You are thinking like that, but it is not yet proven. Next is study design. Study design means how you are going to conduct your thesis. Be either be prospective, retrospective, cross-sectional, case control. So we have discussed about that in my previous video. You can go and check it out. Next is inclusion and exclusion criteria. In this particular example, you have to include a patient with high myopia and patient with moderate myopia. Exclusion criteria, you have to exclude the patient which can influence your data unnecessarily. Let's say if you take a patient with a curvatural or positional myopia, in this can alter your data. If you take a patient who has been diagnosed with APVR or ROP, then also your findings are going to change. So this little things you have to keep in mind and accordingly choose a inclusion and exclusion criteria. Now about sample size. Sample size, you have to think very practically. Let's say in your clinic, in a weekly basis, 10 patient with high myopia is coming and 20 patient with moderate myopia is coming. So you have to keep your sample size accordingly, 7 patient per week, and accordingly you have to calculate. It is known that larger data means better reliability, but you have to remember only limited time. Okay, you don't have so many years to complete your thesis. You only have approximately around 2 years. So accordingly you have to choose. You can take a help of your guide in this. Thing you can do is, so you go and study papers on this related topic and you see what sample size they have taken, and accordingly you average the three studies sample size. Now is bias. Bias means what all things can go wrong in your study. So in this particular study, what can go wrong? You might have taken a patient with a very high myopia, let's say 10 or 15 diopter myopia, so that can alter your thesis. Second, your examination technique can also be faulty. Let's say you have not properly depressed and see till the periphery, so you might have missed some lattice in some patients. So that all thing can go wrong. So try to keep biases as much less as possible. This outcome measures. So how you are going to compare this result? How you are going to quantify that? So let's say we have examined 100 patients with high myopia and 100 patients with a moderate myopia. Out of 100, 80 patients with high myopia had lattice degeneration, while in moderate myopia only 60 patients had a lattice degeneration. So the prevalence is 80% in patient with high myopia, while it's 60% in patient with a moderate myopia. So obviously there are high chances of lattice degeneration in a patient with high myopia. But again, is this by chance or it's a real difference? That will be determined by p value. What is the p value? P means probability. Probability of your result being by just by chance or random. So let's say if your p value is less than 0.05, that means there is a very less chance that whatever result you got is just a random or by chance. And if p value is greater than 0.05, that means there is a high chances that whatever result you have got is maybe random and by chance. So I hope this video has cleared many of your doubts and you will start writing your thesis with much more clarity and with confidence. So see you in the next video. Till then, goodbye.